Good morning, everybody. Hi, everybody. My name's Sonia Rye, and I'm the chair of the Business Theatre today. I would like to welcome Nick Swash from the Yorkshire Care Alliance. We've been talking a little bit about what the Yorkshire Care Alliance stands for, and I think what I've got from talking to Nick this morning is that it's coming at things from a totally different perspective. It's a solution-based alliance. And the whole ethos for the Yorkshire Care Alliance is based around working together and making a difference. So really looking forward to hearing more from Nick around the Yorkshire Care Alliance and the support that they provide. Thank you.
Okay, thank you very much, everyone. First, Yorkshire Care Alliance is in Yorkshire, but it isn't just Yorkshire. So if you think of Yorkshire Tea as a national brand, Yorkshire Care Alliance is a national brand. Not quite international yet, so I'll explain how that kind of works. And I think what was said earlier, we're coming at it from a totally different way. Different ways of looking at it, different ways of working, and it's quite revolutionary. It's not to say it's going to work, but it's revolutionary. So I want to take you through what we're doing, and you'll make your own judgment at the end of the day. Our primary ethos is working together, but what does that mean? Care providers tend to be very individual, commissioners likewise. So we actually are an all-encompassing sector. So we involve suppliers, providers, unpaid carers, commissioners, educationalists. So we're all part of this alliance, and we think that way we can actually build together a cohesive force that will work together because it can see things that can change. Is the Yorkshire Care Alliance going to make a change to social care? No. Are we going to make a difference in social care? Definitely, but in small chunks. So let me give some context because how we originated. If you look at 54 years ago was really when local authorities had the responsibility for putting together effectively a social care mantra. So 54 years we've been around in social care. If you then look at what changed in the 1980s, 35 years ago, it was decided to kind of privatize social care, and local authorities were told to try and get a better value for money 35 years ago. So if we look at what's going to change in the future, we know there's an election coming, and we know each of the parties have social care somewhere in their portfolio, but history would say it's getting worse rather than better. We've not made the changes that we need to do. So our view is, let's not work with the governments on trying to make things better. Let's work with the industry to try and make things better. So working together is about trying to get us and this whole collective here working together. So if we look at some of the stats, 9%, 12% private. So we are reliant on care authorities and ICBs for the funding to make social care. But here's my problem. Actually, the numbers of people that require funding has dropped. And if you look at the King's Fund data, it's going this way. So we have a major issue in social care that everyone's aware of. If you read all the reports, the King's reports, all the other reports, they're brilliant. They tell you exactly what the problem is. But nobody is actually doing anything about it. You know, each report says recruitment's a problem, retention's a problem, quality's a problem. Yes, we know that. What are we going to do to make a difference? Because we can't rely. So our concept is that we're putting together what we call the care cycle. We talk to unpaid carers. Now there are between 4 and 11 million unpaid carers. Why is there such a gap? Because nobody actually knows. Nobody records. Local authorities do not record the numbers of carers in their sector. So these are the beginning for social care. These are the forgotten people. Unpaid carers will ultimately need help. Home care is the first point of call. Home care will then need help. Residential or supported living is the next point of call. So they're living independently. Then it goes to residential, then it goes to nursing. Now, nobody, in my view and in our research, is actually talking about the circle. They're talking about home care, residential, unpaid carers, and there's some phenomenal work going on, but in isolation. The Yorkshire Care Alliance job is to bring them together around the table to say, your unpaid carers are your future care resource. So you need to work with them. You need to make sure they know what they're doing, when they need to trip to home care, when they need to trip to residential, and take away this belief that going into the next stage is a failure. It's not. It's a part of life. So we also have a different view. 64 billion, as regards the CJS report, is spent on social care or associated areas every year. Now, unlike other parts of the world, we actually think that's probably enough. What we think is there's probably 10 to 15% of wastage, duplication in that area. So our job is to try and make that 6 to 8 billion available. And wouldn't it be nice as a residential if you can actually make more money and go back to the LA and say, good news, actually I want you to charge £20 less per room per night because I've actually been able to make this efficiency in this area. Now, what does that mean? That means that £20 goes into their funds, which means they can actually start doing more with the people that aren't getting funded, because we need to provide the solution to their problem, not their solution to our problem. So we created this alliance to be different, totally introspective, totally joint produce. We call it co-producing. So we, with our alliance members, we actually co-produced where we go strategy-wise, and that's educationalists to social care providers to ICBs and local authorities. They're all involved in the loop. And they came up that we need to be collaborative, working together, we need to be in community, and we need to share best practice. How many people share best practice? Not many, to be honest, because you're all independent businesses if you're a provider, and you don't take the cognizance for LAs or ICBs, so we've got to do it. So that's our mission, and we think that we can deliver it. So the care cycle, now we've included another cycle around there, which we'll talk about, which is actually the condition cycle. So within that care, you have learning disability, dementia, autism, mental health, and we are creating streams around each of those, so we overlay that. And then we've overlaid a third cycle, which is who actually provides the income. Private, LAs, local authorities, and ICBs. All of them have to be part of this working together, because if we come up with solutions and we go to them and say, yeah, here's the idea, it's about like us going and saying we'd like £15 an hour for care workers. Very admirable, very good, totally unrealistic, because we're struggling to pay the current living wage at $11.44. How the heck could we pay £15 unless the funds come through? And we know funds would be a bit tight. So we co-produce 6 streams. Now this is the difference. These 6 you will see in every business report. It'll say, these are the problems, thank you very much. 2 years later, here's the problems, thank you very much. But who is actually doing something about them? So we decided that we wouldn't take fees from anybody. You know, we don't have memberships, we don't have fees, we don't take authority grants. We are totally independent. We're relying on benefactors and donations who see the benefit of that independence, so we don't have to sway to local authorities' way of working, or sway to an ICB's way of working, or even sway to a member's working that says, go and lobby for £15. We don't lobby, we don't charge fees, we only provide solutions. So to give you an idea, education, how we want to do is influence, and we take small steps. If all of you, and some of you are old enough in the room to know the starfish area, where you throw 1 starfish back in and someone says, why do you do that? There's 1,000 on the beach. Because you can just change with 1. Because if 1,000 people throw 1 in, there's 1,000 gone in, and that's what we're trying to get. So we went to Coventry University and we looked at their curriculum for 24, and of their care-related courses, NHS courses, 90% was NHS, 10% was social care. Is there any wonder that the people leaving the course do not come into social care? Because they don't really understand it. What's the difference between home care, residential? What's supported living? What's learning disability? So we have changed their curriculum for 24, and now we've got 60% NHS and 40% social care. We've now found ways for their students to come into the areas and visit social care, get involved with it, engage with it, understand that it's a career. It's not something that you do when you've not done anything else. So we're attracting more people in the future, not now, it'll be 25, 26, 27, but we're changing the way education thinks about social care because they don't think. I happened to be at a meeting with the Minister for Apprenticeships and for Further Education last week, and he was oblivious to social care. Yeah, he's in charge of the apprenticeship for social care. So we started talking about the problems with apprenticeships. We also then said, well, do you realize that 20% of care workers are actually back office workers? 20%. So that's IT, accountancy, marketing, administration, all of those. Why can't we have apprenticeships specifically to there rather than just care related? Maybe that will bring a new breed of 16 to 24 people coming through who can then live through. Because otherwise, we're all going to grow so old that there'll be nobody to care for the carers, because we'll be actually in care ourselves if we don't bring the new people through. So that's how we're making a small difference. We're going to do it with Sheffield University, and we'll start moving through. And yes, they're all Yorkshire, but I'll come to that in a minute. Recruitment and retention. We did some research. People that go through to an interview or advertise for an interview, generally if they're in social care, they know, and that's why 30% churn moves from one to the other. If they're not in social care, they don't know what social care is. Yeah, they don't know whether their purpose. Do they want to be resident in a care home and work with a small number of people? Do they want to be mobile with home care and have a multiple geographic area and cover? Do they want to work with one individual in learning disability or in supported living? Do they want to be in nursing, which is much more? The answer is they don't know. And there is nobody out there. Even Skills for Care's website isn't as informative as we think it could be. So we're creating a whole band. The other thing we're doing is creating group recruitment. So in a particular area that we're working on in Scarborough, there are 54 providers of home care, dom care, and there. We're getting them together to actually have a joint recruitment campaign that brings quality people in and then selects where they go. Yeah, we're not in competition anymore. There is more capacity out there than can possibly be filled. So by working together, everybody can get the right person in the right job that will stay. Training and development, we've looked at it. Mandatory training, fantastic, but very costly, but necessary. So we've redefined mandatory training, and we have our policies that go out that make it work. But we also really found that in mandatory training, there was one bit missing that was actually causing a lot of sickness and mental health, which is bereavement. Nobody goes into the industry knowing, well, they know that they're going to come across death and terminal illness, but they don't know until they've gone through it. So we tracked a few people, and from coming in to their first incident to their mental state after it was pretty bad. And that caused them to think, I don't really want to be in social care. I better go and work for somebody else. So we have adopted a bereavement course, which we've designed specifically, and we're now adopting it in certain areas as a mandatory training. And we're going to track that and just see if that helps absenteeism sickness rate, or just brings to life that it is a fact of life. If you're in social care, it will happen, but it's not a negative. Here's how to overcome it. Here's some of the emotions you need to bring in to do it. So again, it's not going to change the whole of the world, but might just change a small bit. And then we come to communication, which is our working together. Unfortunately, social care, and I've got to be honest, I've been in social care 2 years. I'm a novice. Yeah, I came from industry, I ran large corporations. So I look at social care as a platform without any baggage. I look at it and say, if I'm starting from a clean piece of paper, what do I need to do to make a difference? And then I have a team around me who's been in social care for years who can say, don't be stupid, Nick, that's an impossible, because we tried that 32 years ago and it didn't work. And I say, great, let's try it again now, because it might actually work. Everything is timing based. So working together is critical. So we've got a positive voice. People that join the Care Alliance know that we're not going to be negative. We're not going to talk about problems. We're only going to talk about solutions. But more importantly, they have to help us with the solutions, because working together is the only way we're going to do it. And then we come to the business. And this is why Yorkshire Care Alliance is not Yorkshire. We have this plan, which is in operation at the moment. It's called clustering. And what we do is we get 8 or 10 providers across the sector, and some educationalists and some Care Alliance and some authority people, and we get them to work as a cluster. And they look at the local issues, and this is the cluster that's doing the recruitment together. And they look at what they can do as a cluster to get it done. Still independent, still technically competitive, but working to talk about best practice. Yeah, how do we overcome this new CQC framework? Who's doing well? How are you uploading all your information? What's the best system to do it? Sharing information and working together. Now, the idea is we have one in North Yorkshire, South Yorkshire, West Yorkshire starting. Now, when we get enough clusters, what we want to do is federate. So independent as they are, but a federation is a body that they work with. Now, a federation can employ its own staff. So imagine all these back office staff that are doing accountancy for everyone, that are doing HR. What would happen if a cluster had its own HR manager, 10% of it paid for, rather than 100% paid for? How much more money would go to the front line, and maybe their pay could increase in the front line. So these federations would actually have a legal responsibility to each other without having the accountability of being part of the big group. And so we have now Alliance members in Bournemouth, in London. We don't have enough at the moment because we need them to grow. So once they hit 6, we start the cluster. Once they get to 10, we start building another cluster near them so that we can create them. So this embryonic way of working is revolutionary, because otherwise you have national associations, regional associations, and people, and that's why nothing happens. So these clusters are action-based change momentums. And then digital AI. We work with a lot of suppliers, and because we have Alliance suppliers, make sure I'm not too far over, Alliance partners, we talk to them and say, and there's many around this room here, you know, do you really know what you're trying to do? You know what your business says, so you know there's a market in social care, you know there's a great opportunity in social care, but do you know how to get there? And I'll give you a perfect example. We had a meeting with a new product development company week before last, and they said, wow, this social care market, worth billions, 29,000, 30,000 distribution points. I only need 5% of those, and I've made a lot of money. And we said, well, okay, how are you going to get there? Well, yeah, we're going to go for home care. Okay, so you want a home care provider to spend £2,000 on a product that it's not going to get the return on investment to put into a home that is really going to work? No, I don't think you're going to get that. So perhaps you need to go to the unpaid carers, because they're the people who might be able to use this product better. But how do you get to unpaid carers? So they had their brilliant idea, they had a brilliant product, but they weren't sure where it was going to fit into the market. And everybody knows how tough it is to get to the independents. So these cluster groups always provide the opportunity for digital AI. They are the working parties that can say, in our community, in our district, we as providers and health authority personnel think we need to have this. And if you give it to us, we will then adopt it. And then we will be your test pilot, and then you can take it forward. So you're creating a way of getting digital and AI into the organization, but driven by the people that use it, not driven by a company that believes it's taught to the people that use it, because everyone uses it differently. So we're working now with quite a few companies on AI, and there's a fantastic company over there which is doing visual training through areas. Phenomenal. So we talked to them about our unpaid carer business, because we, next year, subject to funding and some nice benefactors, we're going to open up regional care banks, because the unpaid carer cannot afford to keep going. The allowance at £72 and £118 is not enough. You take incontinence pads. the average cost is about £60 for a person per week. And we're saying, well, where do you buy them from? Amazon. You know, why don't we have care banks that have incontinence pads that are much reduced price? Why don't we have training centres like this digital one so people can come in? How many unpaid carers know about material handling, moving and handling? How do they know about safeguarding? They don't. We just leave them to get on with it. So these areas are where we're trying to work with companies to say, let's move forward. If somebody can come into a care bank and take one of their visual aids out and take it home and use it that night, bring it back in, or we have a centre where they've got a training area, they can go in, just spend an hour's break, just picking up on what they're doing and how they can improve it, how they can take away some of their pressure, then that will make a difference. So we have a manifesto. Yeah, we had to set a target. If we're an action-based business, we've got to have something that we aspire to do. So we think 20% job satisfaction. In the businesses we've tried it, our retention has gone down, or our churn has gone down from the average 30% now down to 12%. So we are doing something right on that one. The job satisfaction has gone up, so we think we're doing something there. Training, we're going to test it. We haven't done yet. We're testing the disability across a range of 500 new employees. We'll know within a short space of time. So the difference between every other organization to some degree, I don't want to be impertinent, is that our idea we can test in our organization and our clusters, and we can fine-tune it to make sure that it works for everybody, rather than just having an idea that we throw out and you say, work for me. Communication, the cluster we talked about, business networking, digital. So each of those areas co-produced, our clusters are working on them, we're growing slowly. We don't want to be an overnight success. A, we can't afford it, and B, it won't work, because it has to be sustained. This is an evolutionary way forward. One cluster lends to another cluster, that lends to a federation, that lends to a geographic approach, and then eventually we'll have a share of voice, because at the moment, social care does not have a share of voice. It has a national presence with the national associations in government, but if the government says to a national organization, fantastic, actually what we want you to do is I want you to make sure that every NHS blocked bed is emptied within 2 weeks. The idea is, sorry, I can't do that because I've got to go back to my providers and I've got to talk to them and see what capacity they've got. Whereas if they said to it in a cluster where we've got a cluster, York, using North in the game, but York, trying to think, hospital has 22 blocked beds. So the York cluster says, what are we going to do about it? Yeah. Do they need home care? Because you're in home care. Can you get some capacity? Do they need residential? Do they need respite? Because they want to be there for a short time. So we go back to the NHS, and this is where the money comes in. Because last year the NHS gave a fortune to local authorities to get the beds unblocked. It was in excess of 27 million, 2.6 in our own area, and they didn't use it. It went back into the coffers because they couldn't get the money out. So our clusters are the way of going back. So solutions, not problems. And working together is where we are. So we're national, join us. If you want to build a cluster, fantastic. If you want to just sit until your cluster comes, great. On your seats are some information and a few pads, but your destiny actually is not anywhere else but in this room. You're in charge of your destiny. Just take control of it, own it, work it, and make it a success. And at the end, make a difference. So thank you very much. I don't know, a lot to take in. Is there any questions? We have a mic or something that, or has it all baffled you? Can you see the difference? Can you see how it might, and it is a might, we're not saying we're going to guarantee ultimate success, but can you see it's maybe a slightly different way of looking at it? I got the nods in the audience. Brilliant. Well, we want you to be an associate. We want you to work with.
Yeah, that was a great talk. Thank you for that. And you're absolutely right. We do have to work together because I'm a small independent care home, and I'm based up in Wakefield in Leeds, and we've had to get our own cluster, we've got 17 registered managers that just be working together. And it's surprising that from the small independents even to the larger ones, all of them need some support, especially the registered managers level, because it's a very lonely and isolating place to be in. So yeah, absolutely, it's something we would be interested in.
Great, thank you. I mean, one of the things that we've got up the track is actually sharing resource. I mean, why should we not have a capacity to be able, because if you're successful in the future, you're going to have a flexible policy. The old 40, 60-hour week, registered 13-hour shifts, 12-hour shifts, that's not what the new world wants. The new world wants flexibility. So, you know, that's something that we can have to find a working with. The other thing that we're working with is every carer that is no longer a carer is an opportunity. They've cared, they understand, they're perfect. What they don't have is mandatory training. They don't want to work 70 hours a week. Their life has been working 144 hours a week. So, but they are superb. They're the people who will be able to come and have the empathy. But we've got to get them from being, and let's assume they're in their 50s, even early 60s. CV, CQC. Can you give me a CV right back to 16? Now, I can't remember when I was 16. How the hell am I going to know what I did between 16 and 18? So we have to overcome those issues. And we can do risk assessments, we can do things that make it work. But we've got to make it easy for them to come in. We've got to welcome them. We've got to train them to the level that they need to be trained. And we've got to use them. Because if not, we lose them. And that is a major loss. So again, clusters work in all these dimensions. But I think, thank you for that. Yeah, it does prove it.
Thank you. Really, really cool talk. I love it that you talk about clusters and working together. We're a small software provider enabling collaborative staff sharing. So I wonder, does Yorkshire Care Alliance partner with companies or have these discussions to enable these kind of things?
Yes, we don't use the term partner in the sense that requires a more formal relationship. And we think that we don't want to tie ourselves into. What we do is we work in conjunction with, so we're quite happy. If someone comes to us and says, I've got an idea, we think it'll work, what do you think? And we'll put it through the clusters and get a feedback. Or I've designed this, how do I get it to market? Where's the areas? Or I just want to, we have sheets of ambassadors. We need more ambassadors, people selling the message. This is back to that starfish area. If everyone from here went and told 2 people about it and thought, that was okay, I can see it, and those 2 people told another 2 people, suddenly that starfish concept grows. So yes, we'd be love to have any association with us. We're a very lean team, that's why we can't grow overnight. We're not going to resource with millions of people and then require lots of budgets. You will actually pay for the growth and development of Yorkshire Care Alliance through your time, maybe occasionally through a bit of money if you're going into federations, but we're going to be the directors and leaders of the change with you, not the payers of the change and building an infrastructure to do it. Because otherwise, 5 years down the road, we'll be back to square one. You've got to really believe in it, want to do it, engage with it, and it's not for everyone, not for anybody whatsoever. I would think 50% of social care will not buy into this, and that's fine. That's their prerogative. But 50% might, and if that 50% can change it for everybody, it's a win-win all round. Brilliant. Okay, time's up. Thank you very much. Really appreciate it. Thank you.